clinical people are striking because we are misdirecting their money to something else. Madam Chair, let us reduce this budget to 20 or 30 billion and devolve this money to the counties. People who need services, medical services, are in the counties. They're not in Nairobi. Why do you want to have Afya House to have 140 billion when a county like Kiambu and Muranga are only having 2 billion for health services, Madam Chair?
Thank you.
We cannot.
Member for Mandera North.
Chair, thank you very much. Chair, when I look at the sum allocated for State Department for Medical Services, it is 102 billion. We all know health is devolved. The last time the Ministry of Health has done infrastructure developments or something in the counties, I don't even remember, so before devolution. So why will this money be at the headquarters when we know that health services are also devolved? Is there also issues or certain aspects whereby this money will help each constituency in terms of health facilities? If that is the case, we will have no problem. But there are no provisions for that. And I'm sure Chair Health is sitting here and he understands. We do not have any money allocated or helping us in the constituencies for health services from the Ministry of Health.
Okay, thank you.
All the constituency require is they get the money from the county governments. So we need also this money to go down to all the constituencies. Thank you.
Honorable Member for Thika. If you're not on this, kindly remove from the intervention so that we can give members a chance.
I'm not for this. Let me remove the intervention. Thank you.
Thank you. Honorable Member for Mogotio.
Thank you, Chair. And before that, I must put into record that I'm a member of the Health Committee and I'm a part of those who sat for this budget for the Health Committee, Madam Chair. Madam Chair, it is fair to let Junet Mohammed know that Kemri is part of this budget, and the Kemri sits in national government. KEMSA, which get drugs to give to this county, sits in national government. KUTRH, Kenyatta Hospital, Moi Riverol, and Chief and the Shah sit in national government. Before he start, these professional bodies dealing with the elder, including the KMPDU and the rest, sit in national government. So before my brother Junet say it should be reduced to 30 billion or so, he should ask himself, where does this money go? And where does this money go in terms of services? If you talk about KUTRH and
Honorable Farah.
Madam Chair, Madam Chair, we have a problem in this country. We are complaining about money being wasted through corruption at the center. The little that we have taken to the periphery is also being misused in a manner you cannot imagine. I remember when the fellow who's sitting next to me, Professor Nyikal, was the Director of Medical Services here. And we are much, much better off. Can we have kind of a middle ground in which the only way we can stop this wastage is not to choose between two ills or two evils, but to create a national health management service or commission, whatever. A national health commission, which is going to take care of, like the UK. UK has got what you call the National Health Services. So let's have that independent body, which is run by professionals, people in the field of medicine itself, who will be able to, a doctor has got a Hippocratic oath, and worries about saving lives. It doesn't matter what part of the world he comes from. He could come from the most capitalist, most things, but at the same time, he will take care of this. So let us change this. Let us not choose between two evils. We have a serious problem in provision of health services at the county levels today. And the only way we can do it is that we get away from the center, but we also create this national, health commission that's going to take care of.
Thank you. Member Honorable Dan Mwashako.
Thank you, Madam Chair. I stand to support this, but as I do, Honorable Chair, I want to agree that this country, we must honestly make a decision when it comes to whether how much money should remain in the center and how much needs to go to the devolved counties, so that, Chair, we can offer the best services to our people. But Chair, having said this, I want also to say that the number of referral hospitals in this country are too few. We may need to only have Kenyatta National Hospital, you have KU, and have Moi, and you have Madare for the Madare. But I think we need to have more hospitals, one in the coast region, one in north and eastern, so that, Chair, our people can continue to get these services, specialized services when required. Thank you, Chair.
Honorable Elachi.
Thank you, Chair. Chair, while we support, I think for us as women, my question will just be, as we increase this, we've removed Linda Mama, yes. Is it part of the seed money for SHIF that will now assist the women to go back in the program they had? And is it possible through the same program to bring in now our children, because we don't have EDU, so that they can also get into SHIF that will assist them when they are sick in school, Madam Speaker. And also on the issue of a maternal newborn child and adolescents. You see, when we bulk adolescents, and we are not even saying how the ministry is going to help these adolescents, also it leaves it so vague. The problem is not the figure. The problem, Madam Chair, is how the services have been now coded. And so everyone is left wondering which code is going to shift, how much is the seed money. If that was there, I don't think any Kenyan will have an issue with this, Madam Speaker.
Thank you, Honorable Jamatia.
Thank you so much, Madam Chair. And I also want to add my voice on this, that the monies that we have allocated to medical services is quite a lot of money, considering that most of the services, as most members have said, is actually deteriorating in our hospitals, health centers, and specifically the programs like Linda Mama, which was actually affected so much because of the change of programs. And as much as I understand, these monies is always appropriated depending on the needs. And the national bodies like the referrals, as much as they need the money, we should also consider the lowest pyramid where most of this money should be going. I think as much as we are discussing this, the need is more dire in the ground or in the low levels than in the national levels, because these are institutions that are always getting money all the time. Thank you, Madam Chair.
Chair, Health Committee.
Thank you, Madam Chair. Madam Chair, when you read the fourth schedule of our Constitution, the Constitution gives the national government all national referral facilities. It also gives policy. And when you look at this budget takes care of all the referral facilities. Among them, Madare, which is a special mental hospital, Kenyatta National Hospital, Moi Teaching and Referral Hospital, Kenyatta University Teaching and Referral Hospital,